much.
Thank you. Then now Mr. Kaczmarek for 2 minutes.
Madam President, ladies and gentlemen, 4 years before the MDG's implementation deadline, the number of TB cases in the world is still a cause for concern. TB is a curable disease. Unfortunately, it is a serious problem in developing countries, especially in Asia and in sub-Saharan Africa. According to recent estimates, almost 2 billion people are carriers of the TB mycobacterium, which is 1/3 of the world's population. And statistically speaking, 1 in 10 of them will suffer from TB. Poor regions of the world are particularly prone to increase in TB incidence because the TB develops better as a result of bad diet and poor housing conditions, and as well as stress. In many countries, access to effective treatment is also limited, and there is lack of coordination when treating both AIDS and TB. Governments of developing countries do not spend enough for health care. Additionally, health services in rural areas suffer due to lack of personnel and means to treat these diseases. That is why in countries with limited financial resources, the ones who suffer the most live in rural areas. Well-off countries spend at least 5% of their GDP on health services, and in developing countries they spend only half of that. So we cannot increase health budgets in poor countries without external aid, and Mr. Goerens mentioned that as well. TB is not only a huge medical problem, but also a social and an economic one, because it leads to a drop in productivity, and this means that our response to the threat should be decisive and full of resolve, and make these vaccines fully available. Thank you very much.
Thank you. Next, Mr. Cortés Lastra for 2 minutes.
Madam President, Commissioner, dear colleagues, health is really something that we've got to concentrate on. With the MDGs, we promised